and Samantha's going to be really focusing on those aspects. So there's going to be quite a bit of new information during this conference call, so we'd really appreciate if you could give us your full attention and close any browser tabs and windows, and have a pen and paper handy, because they're really hoping that there's going to be some good practical tips that you can take home and practice immediately. Now, if you stay until the end, there will also be some bonuses available, including some MP3 files from Dr. Clarke and some other ebooks and so on. So just a little bit about the two of us. Many of you would know me already as being a certified shoemaker physician who's dealing quite a lot with these sort of conditions, particularly chronic inflammatory response syndrome and Lyme-like illnesses, and chronic fatigue syndrome, which is really has a very large overlap with CIRS and Lyme disease. Now, Samantha Clarke is a clinical psychologist and also a personal trainer and health coach. And Samantha runs, she lives on the Sunshine Coast in Australia, the same area that I live in, and she runs retreats for health professionals and so on, and one of which I was able to go to recently, which was really quite special for me to see some of the techniques that she uses to, well, to help health professionals to increase their self-care and so on. So really excited to have her share on some of the practical things that people can do to deal with their illnesses. So before we go any further, just want to mention that there's a huge symptom overlap with these three disorders that we're talking about today, which is chronic fatigue syndrome, or ME, and Lyme disease and co-infections, and also fibromyalgia, and also chronic inflammatory response syndrome. And so often these conditions can be quite hard to differentiate, and the suffering that people go through with these conditions is often very similar in some ways, although there are some differences which we may touch on briefly. So I'd like to hand over to Samantha at this point to talk a little bit about her journey and her story in getting interested in these conditions and the psychology behind them.
Thanks, Sandeep. So I've always been interested in psychology, probably since I was about 12 years old, and I had a dream when I was about 12, and this dream really freaked me out. So I started reading up about dream analysis, and pretty much around being about 12 to 13, I got really hooked on wanting to become a psychologist. It's just something for me that's been really interesting, and being able to help people to look at the way that they're thinking about something or responding to something has been really important. So I have a private practice on the Sunshine Coast, and the type of psychology that I do is contextual behavioural science. So what that means is I look at everyone individually and how their illness or how their experience is impacted by their environment, and also how they respond to their environment. And as you know, with things like Lyme's or CIRS from mould contamination, there's so much about our environment that impacts the individual. So really the way I work is targeting treatment to work with specifically what's going on for that person and understanding the function of their behaviours. So this particular topic's really important to me because I have mould contamination, and luckily since working with Dr. Gupta, that has come to a really, it's been in remission, which has been great. So in about 2003, I lived in a mould contaminated house when I was studying. And over that time, I noticed a whole range of symptoms starting to spark off in my body. I didn't have a clue what was going on. Just one day I would feel very floppy, fatiguey in my muscles. I would be irritable. Sometimes I would feel really down and depressed. And then other days I would feel completely fine. So over this time I went and saw a number of different doctors and felt like no one really understood what was going on for me. So they'd tell me things like, you're just too stressed from doing your PhD at uni, you know, you have a family history of depression, maybe you're depressed. So I felt quite confused and invalidated about what was going on for me. So over that time, even though I was experiencing mold and the impact of mold, I don't feel like it really hit its full force at that stage. I moved to the Sunshine Coast, and anyone that knows the Sunshine Coast knows that it rains quite a bit here. So the first house I lived in was quite mold affected, but still I didn't really know how toxic mold was for my particular body. So over that time, again, the symptoms continued, but it wasn't until about 2003 when I went travelling to Thailand and I got this terrible gut parasite that something after that time seemed to really trigger my mold, and my CIRS symptoms really began. I had my first panic attack, which I'd always worked with clients on and never really understood just how difficult it was until I went through my own. I had very erratic emotions, feeling very irritable, often days where I couldn't get out of bed and my brain just didn't seem to work. So luckily over that time I found a treating clinician, Dr. Gupta, and really felt like I had some conclusion as what was going on. And once I started my mold treatment, I actually started to feel like my old self. And the thing that's really interesting, I guess, is that over the time that I've been studying psychology and understanding, the different, particularly things related to depression and anxiety, I really noticed how much a lot of my CIRS symptoms mimicked those of most mental health issues, which is why when I went to the doctors, they would often say to me, no, this is just fatigue, no, this is stress, no, this is depression or anxiety. And I know when I look through Dr. Schumacher's, 37 symptoms that he links to CIRS, as a psychologist, I think about 25 of those symptoms are linked to mental health issues. So if you are feeling like there's some differences going on for you psychologically, that would make a lot of sense linked to the illnesses, whether that's CIRS, Lyme's or chronic fatigue. As soon as I started my mold protocol, I started feeling like my old self kind of came back. I felt like I was interested again in interacting with people. I was creative again. I wanted to re-engage in life, whereas before I felt like a shell of myself. So what this has done for me professionally is it really makes me start looking at depression and anxiety as often symptoms for people as to there's an underlying cause. And whether that's an underlying cause from a lack of meaning in their life or an underlying cause from some grief that they've experienced, it's very much also linked to physiological issues that might be happening. So whether that's CIRS or Lyme's, we want to start looking at maybe depression or anxiety as further exploration as clinicians. The other thing is that CIRS can be really confusing and debilitating for people, and I know that from my own experience. So when clients come into my clinic and I know that they're suffering from one of these conditions, we really make it clear that this is probably part of the illness based on what their body is going through, but also the way that they're, not experiencing the help that they need or the understanding that they need from people. As a psychologist, it also helps me to think about how my psychological techniques and what they're aimed at addressing, so things that help to improve the limbic system, which we'll talk about, help people to gain greater self-acceptance or perspective taking, can actually reduce some of the overwhelm that comes with CIRS or Lyme's or chronic fatigue.
Yeah, so it sounds like, Sam, that this whole brush that you had with CIRS kind of opened up a whole other dimension of psychology for you. Is that right?
Absolutely. And I think the more and more I learn about psychology, the more I just see the link with what's going on with our bodies, and more of the more recent research into psychology is showing that, you really can't separate the mind and the body and the impact of toxins as a result of psychological health.
So would you say that probably the majority of people then with these sort of chronic health disorders probably need to have some kind of strategy for looking after their mental health as well as just their physical health?
Absolutely. I think that and there's lots of simple things that people can do, so it doesn't necessarily mean having to see a psychologist or counsellor, although that can be really helpful. But there's things and techniques that we'll go through over the session that will really help to make things a little more manageable.
Okay. Next slide.
Yeah.
Okay. Oh, you've already done that. Okay.
Are you on there? Okay. So some of the typical types of psychological reactions that I see in people that present with these kind of conditions are quite severe and extreme. So often we can feel like we're in a state of denial. I worked with a lady just last week who we are suspecting that she has a mould contamination, and for her to really consider that that's something she might need to leave her house or her workplace is something that just feels too much for her to think about at the moment. So she's really in a place of denying that, you know, this is probably what's going on for her. And that's a really typical experience that we see in people who are having to kind of think about maybe leaving their workplace, leaving their home. So it's quite protective denial, but in the long term probably doesn't really help us to get the treatment that we need. One of the other common experiences for people is a sense of overwhelm. So partly that's because of the impact on the limbic system, that your limbic system is reacting to toxins, and that can give a natural fight or flight response continually under, which can make us to feel really overwhelmed. So thinking about, like, oh, maybe I need to leave my environment, maybe I need to make some really significant changes that are hard for me to do at the moment, maybe financially or practically, can feel extremely overwhelming for people. The other big part that I see is confusion, and I know that I went through this as part of my experience over probably 10 years, just not knowing what was going on for me. So going to doctors, being told the same thing around, you know, this is just a mental health condition, or you're just fatigued, or you need to rest, or you need to eat more. I just felt like I really didn't know what to do. And even though I would try strategies to feel better, there was no real change long term. And this is often what I see in people coming in. The big thing with confusion is that if you look again at the symptoms related to CIRS and those linked conditions, there's so much going on with our cognitive ability or ability to think clearly. So we find it hard to make decisions. We find it hard to think rationally or clearly. So we can see that that's a big part of confusion, that physiologically there'll be some changes going on with the way we're able to think about things.
Hmm. And presumably just not having that ability to process information in the normal way that we're used to being able to can create a certain degree of lack of confidence, would you say, Samantha,
Yeah,
or I guess just around daily life?
yes, definitely. It's efficacy. You know, if we're feeling confused, how does that kind of play out when we're at work? If we're not feeling as confident or we're doubting ourselves, how does that play out in our social interactions? Often we notice that maybe our brain's not sort of feeling so switched on, so we start to feel a little bit more socially anxious or socially awkward.
Hmm. Yeah, that's a really good point. And that also brings a sense of overwhelm with it, doesn't it? Just realizing that our cognitive abilities aren't what they are, and just wondering whether we're going to be able to cope with the demands of the day.
Absolutely, and long term. So even if can I cope with the demands of today? And if this isn't going to get better, how am I going to cope over the next year? And then our mind goes into that really feared future.
Mm, yeah, and then so would you say that that can become a bit of a vicious cycle as well? Because then when you start feeling quite a bit of fear and overwhelm, that probably also starts to downgrade your cognitive abilities as well a little bit.
Absolutely. So what we know about overwhelm is the more we're kind of getting bombarded with these difficult thoughts, what happens is it then does create anxiety, which is harder for us to think about things clearly because we've got more of that cortisol running around in the body. Our ability to think rationally is reduced over that time.
Hmm.
So another big part of the psychological reactions that's really important to mention, and these two link predominantly to anxiety and depression, and they will often go together. So often we feel so fearful and anxious about our future when we're experiencing these conditions. So we have thoughts like, I'm always sick. It's going to get worse? How am I going to change with what I'm feeling? But also physiologically, because that limbic system is being activated, we actually get a higher level of the panic symptoms in the body, which increase that sense of fear and anxiety and that sense of dread. But once we have that for a period of time, what tends to happen is we fall into a bit of a heap and we feel this huge sense of hopelessness. So this is never going to change. I'm always going to be like this. What's the point of trying to do anything if I'm always going to feel this way? And so that really overwhelming sense of hopelessness is often what's picked up as sort of depressive thoughts or cognitions. And so that is a vicious cycle. We do tend to get caught in lots and lots of fear, and then we feel overwhelmed by that, and then we get hit by this huge sense of hopelessness around our future.
Mm. Yeah, and so presumably in CIRS, we know that one of the key things in terms of getting better is to get into a non-water damaged building. However, there tends to be a bit of a double bind, doesn't there, in terms of the fact that, the vast majority of buildings are water damaged, and therefore it can lead one to get into quite negative thinking around this idea that, well, how am I ever going to get into a non-water damaged building, especially if I'm not super wealthy and I don't have all these means available to me, and maybe my partner's not that supportive. So it can almost seem like it's a total double bind, and I'll just never get well. Are there any
Absolutely.
thoughts you could share about that?
Yeah, no, I agree with you. I think that it isn't guaranteed. It's really hard to find a property that we feel safe moving into, and the resources, like financially, what we use to try and assess that often aren't available all the time. So I think it can feel really like we're so I'm stuck where I am because I don't have the finances to ensure that I'm going to be able to choose the correct property, and are they even out there? And even if they're mold free now, will they be once I'm living this for the next three to 6 months? So I think that that's a huge issue for people.
Mm. And that can be a really tough one to get over. And in people who have got like a Lyme-like illness or something of that nature, often I think a lot of hopelessness can relate to the fact that that a lot of people on the internet say that they've never been able to get rid of their Lyme disease, and that their bugs just keep coming back, and people worry about whether they can ever get rid of these bacteria, or whether it's even possible to do so. Do you have any thoughts around that?
Yes, I think that the internet can be extremely helpful sometimes, but it can also be extremely problematic. And so I often suggest to people I'm working with to really choose what sites you're going on, but also when. So if you're feeling anxious and hopeless, I do not suggest going and finding information on the internet, because in that moment you're already going to be scanning for threats, and you're going to be looking for information that confirms your threat. So really the best thing you can do is when you're feeling is to do one of the other techniques that we talk about later on in the session, and avoid the internet, and instead go to an informed medical professional, or contact a medical professional who can give you some more accurate information about that.
Mm, great, thank you.
One of the things in psychology that's been much more recent, and I still don't think it's getting probably enough, not widespread enough, is just that inflammation actually is a cause of mental health concerns, particularly things like depression and anxiety. And so we know, this huge connection between mind and body is becoming much, much clearer. And the more research that's happening, the more we're aware that this connection is there. So if you think about CIRS being a chronic inflammation response, we can see how that's likely to then be linked to poor mental health, particularly in the areas of depression and anxiety. It's going to just come along with it as part of the physical consequence of inflammation. So inflammation is a huge source of just naturally starting to feel anxious or depressed. And I guess the other thing to point out is that anxiety and depression may be sort of physical, but also the secondary process to the changes that are happening in your life. So, you know, thinking about those things that we said before, like maybe you're going to have to move house, or the impact that your condition is having on the quality of your relationships. That's a really huge part. So not only are you taking days off work from sickness or being unable to work, also the quality and contact of our relationship starts being impaired. And this is such a huge source of meaning and happiness for people. Also, we start doubting who we are. So maybe when we've become unwell, we start feeling like we're not the same person that we used to be. We don't feel as competent in different areas of our life, and that comes with a huge sense of loss and grief as well, causing more depression and anxiety symptoms.
Yeah, totally. And this slide kind of just explains how what you said, like the actual physical effect of the inflammation kind of, you know, combined with some of these losses in your life. So for instance, the loss of being able to work, the loss of the quality of your relationship, and that seems to be really common, partly because it kind of it creates a bit of a barrier, I think. You know, when people have one of these chronic illnesses, it creates a sort of a distraction, I guess, quite often when people are connecting with their partners, and that they may have to often lie down, or may have to be worried about the environment that they're meeting up in, and other such like things can create quite a bit of distraction, and it can create a sense to the other partner that perhaps you know, that they've got a psychiatric condition going on, and they're thinking they're really unwell even though they look quite well. And I think that can be one part that's very difficult. That other people around us may not understand how unwell we are if we're suffering from these conditions. And then the third thing I put down there is is coming to terms with the causality, meaning just the whole coping with the concept that perhaps a house is making us sick, or perhaps bacteria within our own body is making us sick is quite overwhelming in itself. And would you say that even just coming to terms with that has somewhat of a toll on our psychological health?
Yes, absolutely. I think that, you know, trying to be aware of the places that you can go, and again, feeling like you're stuck in the house that is making you sick, and that you have a genetic vulnerability to mold or Lyme's. I think those things are really quite confronting for people, and they often, you know, when you, particularly the genetic part, we kind of feel like, well, that's change. That's something that I'm exposed to those things. They are going to have an impact on. For me, being aware of that was something that was quite overwhelming, and it took me a while to, you know, think about how to manage that, but also to not be really down about that. You really good point before, Sandeep, about the relationships, and you know, this is something that I really notice in my own relationship, but with people I work with, that often, because there's such a fluctuation in symptoms, and maybe, you know, we wake up in the morning and we're feeling okay that day, and maybe we can do a few chores, or we can go and do something nice, like go out and have a coffee or go for a walk, and then maybe we've got something planned in the evening, and by then maybe our symptoms are really kind of flaring up, and then our partner feels like we're trying to get out of something. So, you know, you weren't feeling that bad this morning. Is it that you just don't want to go? And so there starts to be this sort of sense of doubt around whether you're playing up your symptoms. And I think because with all these illnesses, they're so internal and they can be so fluctuating, it's really hard for partners or people like family to really understand the impact that they can have moment to moment.
Yeah, absolutely. And just it's almost as if like partners being able to understand that kind of fluctuating course of the illness is very difficult. And you know, particularly for males who may not have experienced that level of subtlety of with their health. it seems to just be a really common phenomena that they tend to think that their female partner is playing up, or just basically creating a complex in their head around mold just because they're not happy, or they're depressed, or whatever it might be. And often doctors will go along, many general practitioners will go along with that idea, and that can kind of make the patient feel like they're being ganged up on by their partners and doctors. You have any thoughts on that, Sam?
Yeah. Yeah, I think that's very important. And I guess one of the big things is when you do, if you have a partner that's willing to come with you to appointments and to understand, so even whether they're willing to listen to webinars such as this, go and see experts on the topic to really understand that. I think, we also tend to underestimate or overestimate our partner's ability in the moment to understand. So often when our partner might want us to do something, they're in that place of, wanting to connect with us, and they might be so unaware of what's going on for you that they perceive your reaction as rejection. And so they're responding from that place of feeling rejected and that you don't want to spend time with them or their friends, whereas they're not able to really see clearly in that moment that it is about the illness. So being able to find a way of having communication, I think that's really important. So going and getting a lot of information together, but being able to unpack situations where someone might feel slighted or rejected and come back and repair the relationship by really understanding what's going on as part of the mold condition or the Lyme's condition or chronic fatigue.
Right, so communication is a really big key there. So sometimes I presume people who are feeling a bit cognitively impaired may need to even kind of practice how they can communicate certain concepts to people, just in order to get that communication flowing, even when their brain isn't working that well. Do you have any tips around that?
Yes, I think some things that are really helpful when you feel clear, you and your partner maybe writing some of this information down, or even writing a letter to each other that you can come back to, that's a reminder of what's actually going on in that moment. One of the things that I do for people I work with is we either write them a bit of a summary of what's happened in the session that they talk to their partner about and they pull it back out after times of conflict, or we use the voice memo recording and we might use that last sort of 5 or 10 minutes of the session to provide a message for the partner that they can always come back to. So I would say that it's about practicing, but also noticing that you can come back to these issues when you're feeling a little bit calmer, when your brain's going to be working a bit more effectively, and maybe on days where you're not so caught up in, the symptoms of your condition.
Yeah, great tips, thank you. Okay, now did you want me to talk a little bit about this one, Sam, or were you happy to talk about this one?
You can start if you like, and then I will add.
Okay. So the limbic system, some people have, it's part of the brain, right deep inside the white matter of the brain. And some people have referred to it as the reptilian brain, because it really seems to deal quite a lot with very reflex and instinctive responses. So for instance, the amygdala is very much related to fight or flight or anger type responses, and it can lead one to go into a real fight or flight response, even when something is not really a true danger. One can perceive them as being a danger. And I think, Sam, would you like to expand on that a little bit?
Mm-hmm. Yeah, so a lot of around what's going on with the limbic system is it's the part of our brain that developed, way back when, maybe there were saber-toothed tigers and dinosaurs around, and we really, as humans, are quite vulnerable. Like, we're not very strong, we don't run very fast, so we needed to have a very fast reactive response in our body to be able to fight whatever the stressor was that was coming towards us, or to run from it as fast as we could. So what tends to happen is this limbic system response is quite automatic when we perceive a threat, and there's a whole rush of hormones that go through the body to help you to fight or flight. And then, what that does is activate the autonomic nervous system. Your heart starts beating, your breath gets a little bit more shallow, your digestion stops, all the energy goes into your big muscle groups so that you can run or fight. Now, this limbic system is not very good at discriminating though. So back in when it was developed, it was when there was saber-toothed tigers coming towards us. However, the same response can be triggered by mold or limes affecting the system. So this part of the limbic system doesn't discriminate between an external threat or an internal threat that the body perceives as a toxin. It triggers the same response. But you can see that when your body triggers this fight or flight response when it's a toxin, it's probably not as helpful as when it's with a saber-toothed tiger. The other thing about the limbic system is, as we developed as humans, we got this prefrontal cortex, like the front part of our brain that really helped us to think, to plan, to problem solve. It's really the part of our brain as humans that's enabled us to, be at the top of the food chain, I guess. But what happens is when we have anxious or difficult thoughts, again, this limbic system gets triggered, and then we can respond to thoughts like they're threats also. So what we kind of know about this limbic system is it used to be quite helpful for us, and the instances now in which we're under stress probably aren't life-threatening like they were then. They're more, the fight with the boss or overcoming, how to deal with the diagnosis of mold or Lyme's. But what will happen is the limbic system will still perceive a threat in the body, and then will create a cortisol release of stress. And if we don't find a way of bringing that down, what tends to happen, we're in this constant stress response as humans. So it has a really big response, and we can see that it's actually not very helpful in this day and age, but we can't change our brain. It's just the structure of what's there for us now.
And yeah, so I think probably most people on the call will have had the experience of just feeling really stressed or anxious, but there's no real apparent reason.
Yeah.
And would you say that's a sign that your limbic system is activated?
Yes, absolutely. So what you'll probably notice, and I noticed this when my CIRS was at its worst, was that I actually had a panic attack. So panic attack is where you have 5 or more symptoms that are really linked to limbic system overactivation. So the heart might be palpitating, there's a sense of nausea in the belly, short heart, shallow breathing, tingling in the fingers and the toes, restlessness in the muscles, and the thought that you're losing control or that you're a real sense of fear and dread. So there's a lot of those physiological reactions are linked to limbic system overload. And because, you might, just be waking up in the morning and you might already have that limbic system response going on because of the toxicity that's linked to the illness and the inflammation linked to CIRS. So it's actually very overwhelming for people, and you're not doing anything to create that. It's just literally this old adaptive response of the body that was once really, really helpful. It's just being triggered through no fault of your own.
Okay, so this is actually quite, could be quite a big realization for some of us, is that, that actually I can be feeling stressed at certain times of the day just because of my illness. And therefore, would you say just that awareness in itself helps, Sam?
Yes, absolutely. I think that one of the things that you'll notice when you're stressed is that if you're not aware that, okay, this is my limbic system and this is a part of my illness and I just need to take a few breaths and settle, is your automatic response is going to be to start scanning for stresses in your environment. And so you are going to perceive most things as a stress. It might be a comment from your partner that you're the wrong way. It might be being stuck in traffic. So really by just being able to notice, okay, what's happening with my limbic system right now? And am I able to just kind of take a few minutes to kind of ground myself and be aware that, okay, this is just part of my illness response right now. I'm actually quite safe, and reminding ourselves that we're safe and that, you know, we're not under any threat can be a really good way just to start to help the limbic system to just kind of, or more the prefrontal cortex, to just be aware that you don't need to respond or react in this moment.
And presumably that'll take a little bit of practice and a bit of repetition.
Yes, and really about kind of mindful awareness. So being able to kind of be able to check in with yourself and notice, okay, how am I feeling today? And, you know, noticing, do I have kind of stress responses around my chest? How am I feeling in my belly? And not needing to react to those like they're a bad thing, but just being accepting of, okay, this is where I'm at right now. And I know this is a part of my illness, and that I'm able to then move forward without kind of reacting to the stresses or the perceived stresses in my environment.
Great. Yeah. So even for me, Sam, I think this is a really big aha moment, this slide. So thank you for sharing that.
My pleasure.
And this is also just to look at the actual scientific and physical side of this. And many of you on the call will have had a Neuroquant scan. And Neuroquant is a computer analysis of a brain MRI, which is called a volumetric analysis, which looks at 11 different brain areas and measures their side. So you can see in the top part of this report, what the computer program does is identifies different brain areas and puts different colors on them. And basically these different areas that we've talked about, you know, that have been highlighted rather in blue and red, these are part of the limbic system. And so the ones in red, the caudate and the putamen, these are really areas that are shrunken in CIRS due to mold and Lyme, respectively. And so we see almost in every patient with mold that their caudate nucleus has been shrunken and has been affected by this illness. And the same thing with Lyme disease and their putamen. And these have very definite kind of signs. So, for instance, people with small caudates generally have problems with moving from one concept to another concept. It's almost like this is Dr. Schumacher's observation, almost that there tends to be a bit of a fixation to certain ideas, almost because that limbic system is not allowing the body to move on from one idea to the other one. While people with shrunken putamen can actually, you know, tend to get a little bit of aggressiveness, just simply due to that activation of that part of the limbic system. So that's really quite fascinating. So the normal range is that the caudate should be above or equal to 0.255. And generally what we do when we're analyzing neuroquants is we look at the left-hand volume and the right-hand volume and average them. So in this person, you can see on the left-hand volume, they've got a value of 0.2, and on their right-hand volume, they've got a value of 0.23. So their overall value will be somewhere around 0.215, which is well below the normal value of 0.255. So it's kind of about, I guess, 20% or so reduction, which is very significant. And then with the putamen, the normal is above or equal to 0.345, and in this case, if you take the left side, which is 0.36, and the right side, which is 0.33, and you average them, well, then you get somewhere around 0.345. So this person's right on the borderline of having a shrunken putamen or not. And I think this was actually a mold patient, not a Lyme patient, so their problem was predominantly the caudate. But would you say understanding that and just getting these results can also give the person some awareness of the fact that this limbic system issue is going on, and there is likely to be some of these symptoms on an ongoing daily basis?
Yes, I think that definitely, like particularly when you think about the caudate and that kind of response around aggression, and, you know, being irritable is kind of part of the illness, I think, and that can be, you start feeling like you're a bad person, and there's a lot of shame associated with that, and why am I reacting this way? So I think just seeing that there is actually a physiological change that happens which makes that ability to manage your irritability a lot more difficult is really important for people. So to increase that self-acceptance, hey, this is actually really hard for me, that I'm going through this and I don't want to be aggressive, and I'm going to work on kind of managing my temper, but also knowing that that's probably going to be a lot harder for me than it might be that someone who isn't affected by these illnesses. And when you talk about the putamen and that sort of sense of perseveration or being stuck on the same idea, we would say that, the psychological result of that would be worry. So, or rumination, so constantly feeling stuck in cognitions, whether they're about, a feared future or a difficult past event. So you might notice that there's probably going to be much more of those cognitive elements for somebody with Lyme's disease, where they feel like really unable to control their worry or to be able to come back to the present moment.
Yeah, great. So this is, again, it's another awareness tool. And
Yeah.
so when you know these things, then you can practice these. So Sam's going to go into some exercise later to really increase awareness and mindfulness around this whole concept of limbic system activation. And once you're aware that there are areas of your brain that have been affected by this illness, then you can put in place a strategy. So if you're not aware of something, it's very difficult to put in place a strategy. So I think this is really important, knowing about knowing about the Neuroquant. And the other areas I'd like to touch on quickly are the hippocampus and the amygdala, which we've denoted in blue here. And I think the hippocampus has been considered to be an area that's very much related to just general cognitive ability. And the amygdala, I think Sam, has been related very much to anger responses.
Yeah, and emotion.
And which one, sorry?
And general emotion. So it seems to be like the emotional hub for people in our brain.
Okay. So like emotionality in general. Yeah,
Yeah.
and so yeah. So these, although these areas are not standardly affected in CIRS, we do see some patients in which they are shrunken. And particularly there's a certain subgroup of patients who have what we call multinuclear atrophy. And multinuclear atrophy is when there are 3 or more of these brain areas which are shrunken. And it can actually be due to a number of different conditions, but it can seem to occur in some unusual cases of CIRS. And probably if you do have a shrunken hippocampus, so for instance, the normal size for the hippocampus is greater than or equal to 0.255. But this patient, you can see that their average would only be 0.205. So therefore, this patient can probably expect that their ability to just process information is going to be affected. And their amygdala is right on the borderline of normal, because normal is greater than or equal to 0.10, and the average for this person is 0.10. So they may expect that even if they're on the borderline, there may be some problems with overall emotionality or emotional lability. And maybe certain circumstances or situations may not make someone else emotional, but it may do for them. So again, I guess it's an awareness tool, isn't it, Sam?
Absolutely. Yeah, I think the more we can be aware of, what's going on in our brain or our body, the more we're able to then create strategies to manage that.
Great. So we've already talked about some of these psychosocial stresses a little bit. Samantha, can you see anything that you'd like to expand on a little bit?
Probably just the one point in the blue, the hyperactivity to the thought of being exposed. One of the things that tends to happen when we have one of these conditions is we start becoming very nervous or anxious about going into a situation where we might be exposed. And then what tends to happen is the types of thoughts that we have tend to exacerbate the anxiety we're experiencing, and so it can increase our sense of anxiety. So we just want to be aware of just how much we're kind of buying into the thoughts around mold or being exposed, and of course choosing sensibly, but also not stressing ourselves out too much by the way we're thinking about things.
Mm-hmm. Okay, great. Would you like to talk about this one, Sam?
Sure. So this for me was really about, there's aspects of this illness that, we can't control, like the genetic predisposition or the form of the treatment. So, hopefully you're all going through a really good treatment process. But these are some things that you can do that will help to manage some of the emotional and psychological aspects that are linked to these conditions. So if we go to the next slide, I'll talk about each one briefly just so that we can outline the strategies you can do at home. So one of the big things, and much more recent research, is looking at the role of movement in being able to help in reducing inflammation. So you've probably heard that sitting is the new smoking, and what that means is by sitting we actually increase inflammation in the body. And I'm very aware that often when you feel really fatigued, that sitting is something that's going to be, sitting or lying is a big part of our day. And one of the things that you can do to help minimise the inflammation response is just every 30 to 45 minutes, just getting up and doing just some gentle movement. And you can do that either lying in your bed by tensing and relaxing muscles, moving up the muscle groups from your feet all the way up to the hands, to the face, to the back. But you can also maybe get up and do a few squats just gently, or doing some calf raises just to help move the body. You know that moving your body and creating, just a little bit more kind of movement in any way, it's going to help reduce the muscle deterioration that can come with just sort of sitting still and bone density. And it also helps to reduce the sense of depression that we have. So if you are able to exercise, just even starting with some small intervals, so 2 15-minute walks, but really avoiding this boom-bust cycle. So what the boom-bust cycle is often when you feel good, you tend to overdo it because you're feeling great that day, and then the next day you fall in a big heap. And what that does, it actually aggravates the fatigue response in your body. So what's a much better way is to, even on days you feel good, to just start out with a smaller amount of exercise. So if you normally can do a 30-minute walk, you might just bring that back down to 25 minutes. And then what you do is you work on that 25-minute walk each day, even on days where you feel tired. And then the next week you just add 1 to 2 minutes. So as psychologists, we call this pacing. And it's really the best way to improve chronic fatigue symptoms without putting too much stress on the body. So if you can do movements, even thinking about what movements can I do if I'm bedridden, what movements can I do if I'm at home and I'm not able to get out, and working with somebody around that would also be really helpful.
Yeah, great. And I particularly found that, with males who have chronic fatigue syndrome, that often when they start to feel a bit better, they can tend to go at it like a bull at the gate, as we say in Australia, and and really just kind of start doing a lot of things that they haven't been able to do, almost because there's been a bit of suppression. And particularly with guys, they'll then tend to have a really massive bust, as you say, and be in bed for several days. And so it sounds like some of these pacing strategies can really help people to become aware of this tendency and prevent that.
Great. So one of the other really useful things that we can do is really work on creating skills around mindfulness and meditation. And mindfulness is sort of being able to notice our experience moment to moment with an open, accepting stance, or how we look at something without judging it or criticising it. And what we know is that if we can include mindfulness and meditation, it actually reduces inflammation in the body and it reduces limbic system arousal. So mindfulness, and as you probably know, like parasympathetic breathing, activates the opposite system, helping to soften the limbic system response and activate the sympathetic system. So some really helpful mindfulness tools, and I know, Sandeep, we talked about audio tracks that will be available, which you'll talk about at the end, which is looking at a breath awareness. So I've included an audio track that's around being able to be aware of your breath moment to moment and how to do that mindfully. You could also put on a beautiful piece of music and just notice the sounds, just letting your mind move from one sound to the next. And another really good one for your limbic system is a body scan. So often when we're in that fight or flight response, or we have been, we hold stress or tension in our muscles. And what that does is it actually then triggers the limbic system to go, oh, there must still be a stressor, so I'm going to release more hormones. So it can kind of create a bit of a cycle. So being able to notice when we're holding tension in the body and release that is a really good way of helping to soften the limbic system response. One of the most important ways that I use mindfulness in the clinic is to help people start to notice when their mind is hooking them on helpful thoughts. So thoughts around, I'm never going to get better. What if I never find a cure? What if, those difficult, stressful thoughts that often start with what if? So if we're able to start noticing and watching our mind, and this will be with the movie screen audio track, being able to watch our mind helps us to then notice, right now I'm stuck in a thought that's really not going to help me in any way move towards what I care about. So how can I notice that thought but let it go? So one of the audio tracks, the movie screen, would be a really helpful one to do. The other thing that I've talked a bit about already is really self-acceptance and self-compassion, and there's so much research now around self-compassion being really helpful for well-being. So what that means is understanding what's going on for you in that moment, and rather than judging and criticising yourself, seeing if you can notice, okay, this experience I'm having right now, whether that's adrenaline or fatigue, is part of what's going on for me, and how can I best support myself at this moment, rather than beating yourself up or being stuck in thoughts of never getting better. So being able to be more mindful around and self-compassionate.
Mm-hmm. Great, they're really, really useful tips. Thank you, Sam. Okay, so I was going to say a few points about nutrition, and really, I think one of the keys I wanted to emphasize is simply getting to know your own body and knowing some of your nutritional requirements. So one of the keys of nutritional medicine is that everyone is individual, and what works for someone else on an internet forum may actually not at all be what you particularly need. And your body's going to give you that feedback. And so, for instance, some people may require quite a high protein or a high fat diet, and particularly if you're on the medication cholestyramine, in general, it is recommended to be on quite a high-fat diet because that medication is going to be binding a lot of the fat out of your system, and especially if you're having problems with high leptin levels and high insulin levels and weight. But by the same token, it may be quite possible that that is not the diet that you need, and your body is going to give you that feedback. So what I recommend to some degree is to honor yourself and to allow yourself to experiment a little bit around diet. Now, there are going to be some real important keys, like in general, just avoiding processed foods, avoiding sugar. Many patients with CIRS are going to do better without any wheat or gluten-based products. Probably, I would say, the majority. However, that could be something to discuss with your doctor again. But I just want to bring in this idea that everyone's individual, and just really taking note of what feedback you get from your body if you have, let's say, a higher protein meal, whether it be bacon and eggs or whatever it might be, versus more of a high vegetable meal like a salad or just a meal of steamed vegetables, and just noticing, and then really trying to look at what sort of mix works well for you. And tying into that is looking at blood sugars. So if you get a blood sugar low, then what happens is, again, your limbic system is going to get activated, because cortisol, which is one of the main stress hormones, is the hormone that has to come in to fix the situation if your blood sugar goes low. So if you're eating a lot of sugar or even high carbohydrate foods, and you're more of a high protein eating person, well, you're probably going to find that you're going to get these low blood sugar episodes, and you may find that that leads you to get snappy with your partner or with other people you're around. And it may just purely be a physical thing that you need to be having less sugar and or no sugar ideally, and more frequent meals that are higher in protein and fat. So I really encourage people to tune into that idea of, are my blood sugars going low at certain times during the day, because that's also going to very much affect your depression and anxiety if that's starting to come in, because you really your brain needs a steady flow of sugar to function properly. So again, in general, avoiding missing meals is what's most recommended. I think if you're in a if you're starting to feel low mentally, even though there are some benefits of things like intermittent fasting and fasting, I think my personal experience is that if you're in a state where your brain is not working so well, this is probably not the time to be trying those things out. And it's probably better to wait until you're in a more stable position to then be trying some of those advanced techniques, which is what I'd be considering fasting to be. And just making sure with each meal rather, that you're getting good vegetables, good fats. So it's important to realize you don't have to avoid fat totally. And certain good fats, whether they be coconut oil, butter, olive oil, that can actually be quite important for nourishing your nervous system. And the same thing with proteins, making sure you're getting some protein. So as I said, some people can need more than others, but generally, there's going to be some needed for everyone in CIRS, because generally you've actually got some inflammatory related damage to your body, and therefore protein is needed for growth and repair. And so it's a really important part of the diet that needs to be in there. There's also some basic supplementation. This is probably out of the scope of what we'll talk about today, but most people could find some basic supplements would be quite useful. And Dr. Schumacher, I think, recommends more like a multivitamin, or particularly focusing on the fat-soluble vitamins such as vitamin D and A and vitamin K as being important ones that you may want to focus on in this illness, particularly if you're on the medication cholestyramine. And Sam, would you like to talk about this?
Yep. So one of the other things to think about is increasing your sleep opportunity. So when we're sleeping is often when our brain is detoxifying and our detoxifying. So if we can try and create 8.5 hours sleep opportunity, that's linked to a lot of wellbeing outcomes with the research that they've done. That doesn't mean that you need to be asleep for 8.5 hours. It just means giving yourself time to go to bed, and there's the opportunity for sleep. So remembering that meditation is the next best thing you can do to sleep. It creates detoxification of the brain as well. And things, incorporating sleep hygiene. So if you can go to bed around about 9 o'clock, if that's workable, going to bed earlier seems to be more restorative in the quality of sleep, and reducing your screen time before, so that by the time you sleep, you've got a greater ability to be able to fall asleep at that time, because you're not so stimulated, and it doesn't affect your hormones based to the blue lights that are in the screen time that we have these days. So just trying to really put some effort in around your sleep, and if you're not sleeping, just practicing meditation at that time, which is the next best thing you can do.
Okay, great, thanks.
The other big part for working with, what you can do to start feeling a little bit better is really focus on your social connection. So even if you're not feeling great, try and think about, taking time to engage with people, whether that's family or friends, but people that you feel accepted by. And often a good way to notice is like how you feel when you leave that situation with that person. So really being able to sort of choose people that are good for your self-care. And, if you are anxious about, where you're going to eat or where you're going to meet, just you choose the environment. And, whether that's outdoor settings that, aren't going to be affected by mould, just being able to be in control of where that connection happens. And often when we go out, and we catch up with people we really care about, we can talk a lot about, what we're currently going through, which can often be our illness. But I would encourage you to start connecting with the other parts of your values that are important to you still. Like whether that's, things that you care about or meaningful relationships, but being able to have social interactions that aren't dominated by your illness.
Right. So it's kind of, in a sense, would you say, Sam, that also means connecting with other things that give you joy in life. So, for instance, if you're the sort of person who loves art and music and things like that, then you don't let those things slip away. You want to keep that, those interests going.
Yes. Yes, I think that's a really good point. So choosing those things that sort of bring you pleasure, and even if you can't enjoy them in the same way that you may have prior to this, just giving yourself the opportunity to just get a little bit of joy from those things. Of course, you know that one of the most important things is having a supportive health practitioner, and that might be someone who is very experienced at treating the illness that you're encountering. But you know, we often know that with these illnesses, not every clinician in your area is probably skilled or knowledgeable in that. But as long as you are working with somebody who's willing to learn along the way with you and is willing to you know, make contact with other professionals so that you're getting the treatment that you need, and really about feeling like you're understood and heard. So I really think collaboration is the key to a good, healthy practitioner relationship, where you go into a session with a practitioner, you can tell them what's going on, you feel like they've understood, and they're working with you on your well-being. So really checking out that quality in your health practitioner. And
Right.
probably
Sorry, go ahead.
And probably the next thing would be around, you know, finding a supportive counsellor, which I think is the next slide, is, you know, often when we're going through difficult conditions, whether it's CIRS or Lyme's or chronic fatigue, there's a huge range of difficult feelings that come as part and parcel of that, as we've talked about over the webinar. So working with a counsellor that can support you is going to be really helpful. I also really encourage people to find practitioners that can also give them skills. So it's really good having someone that you can talk to and understands, but also is going to give you some strategies on how to manage these difficult psychological symptoms better, like things like mindfulness, being able to take perspective. So, you know, knowing that what you're feeling now might not be what's going to be happening next week or next year. Being able to notice thoughts that are maybe exacerbating your anxiety and being able to step back from those, but also people that are skilled in treating chronic health conditions, so they can help create a pacing plan with you. They can help give you some strategies around, you know, muscle relaxation techniques, which will all help in treating your condition.
Great. Well, this kind of brings us towards the end here, and this has been really interesting, and particularly very thankful to Samantha for some of the things she's shared during this webinar, because I think it opens up a whole other little way of thinking about this illness as being really something which affects our stress response and affects every part of our social life, and just really bringing in that awareness that Samantha's been talking about. I really believe that this can be quite powerful. And I'd like to just finish by talking very briefly about our 8-week online course, which most of you will know about, which is called Mold Illness Made Simple. And although we're not going to really be getting into much of the information that Samantha and I have talked about today, we hope that this will be included in a further course, which is going to be called Mold Illness Mastery. But in the Mold Illness Made Simple course, I think the key is that even though we're focusing on the physical side of mold illness and the really basic concepts around what is a water damaged building, what is CIRS, how is the diagnosis made, what is the treatment, I think just the importance of being able to understand the explanations in a very simple way that doesn't lead to overwhelm is probably how it ties into what we've talked about today. And if you can get understanding around CIRS and feel like you have a good grasp of it, then I believe that can help with overwhelm and fear. Because, yeah, I don't know if Sam, if you want to talk about that at all, and whether that's been, something that has been the case on your journey, whether just having that understanding is helpful.
Yeah, I'm a big believer in you only can really deal with something when you know what it is. And I think having a really clear pathway of, okay, this is what's going on for me, this is what I need to do each step of the way can be really comforting. And I know for myself, having gone through that, I just feel like, having something manageable and explained to me clearly really helped me to not feel overwhelmed by the whole treatment process that I go through. And just knowing that it's written by somebody who's an expert in the area, that's just, particularly when you've worked with lots of people who haven't known what's going on for you, I think that can be really reassuring.
Yeah, thank you. So yeah, so if you basically are looking at the possibilities of signing up, you can check out the website, which is moldillnessmadesimple.com. That outlines the 8 weeks and the various chapters and so on. And if you decide this could be something useful for you, we are offering a 10% off in the next 24 hours, and that's the coupon code. And there's a couple of e-booklets that you'll also get, including the cholestyramine recipes and the emotional toll of CIRS ebooks. So, do you have time for a couple of questions, Samantha, or do you need to go?
Oh, no, that's fine.
Okay, great. So I'm going to stop the screen sharing now and just quickly open the questions. There's quite a few questions, but we'll really maybe just take two or three and just see if that kind of covers the main themes. So one person, Lisa, is asking, I don't know yet if I have CIRS, but I suspect I do. I'm presently being treated for Bartonella with antibiotics and/or herbals, and find I get a lot of depression, crying, and anxiety about 3 to 4 hours after my dose, presumably talking about antibiotics there, which takes its emotional toll. My LLND, which stands for Lyme Literate Naturopathic Doctor, doesn't have an answer as to why. Could you please comment on the possible causes of this and what can be used to help alleviate these symptoms? So that's a little bit of a multi-pronged question. Do you want me to maybe start on that one, Sam, and then you could maybe talk about how she could deal with the symptoms a little bit.
Sure.
But yeah, sorry, Sam.
Yeah, that's good.
Okay, cool. So yeah, I will say that if you definitely do have Bartonella as a diagnosis, it absolutely will cause a lot of inflammation in the brain. And if that's a definite diagnosis, then basically what's happening is each time you're having a dose of antibiotics or herbs is you're getting some release of toxins from the Bartonella, and you're getting a little bit of an inflammatory flare. And that's commonly called Herxheimer reaction, which is it's a fairly crude name for it, but just for the purpose of this discussion, you can consider it to be a form of a Herxheimer reaction, where essentially you're getting an inflammatory flare each time you're getting a dose of these antibiotics. And I definitely can understand if you're starting to cry and get anxiety and so on a few hours after each dose, that you must be having a bit of a roller coaster ride each day. And there are definitely treatments you can use. Some people use liposomal glutathione, and there's other treatments such as use of, there's a product from Research Nutritionals that is sometimes used, which is escaping my mind right at this point, but it contains green tea, black tea extract, and curcumin and resveratrol. So that's something you may want to look up on their website. It'll probably come to me, but I can't remember the name right at this point. Samantha, would you like to comment at all about maybe how she, some more psychology techniques she might use to help deal with this kind of situation?
Sure. So, Lisa, I really feel for you, because that must be really difficult, and it sounds like you're doing the right things for your health. I would suggest that when you take that dose, that maybe even before you take it, you just remind yourself that those symptoms that you're experiencing are part of the getting well process, and that you're able to be really kind to yourself at that time. So just reminding yourself that that feeling and those experiences are going to come and go, and that how are you going to best be kind to yourself whilst you're going through that. So whether that's, letting yourself, have the space to cry if that's what you're feeling, whether it's, putting on a movie that you can just relax in front of, whether it's asking someone you love for, a cuddle or some time. I would think about, like, if you're feeling that way, what's the nicest, kindest thing you can do for yourself at that time? And just knowing, I guess, that this is going to pass. It's a transient nature of that feeling, as you've noticed. It'll be about 3 or 4 hours where you feel that way, but then that will pass as the inflammation goes down. And I would also encourage, things that help with inflammation, just make sure you're drinking lots of water to help flush things through your body, that you're eating well, and that you're resting, as well as doing some movement, of course. So all those kind of self-care things, but just knowing that that's going to be a transient experience.
Yeah, I think they're great points. And the name of the product from Research Nutritionals is called Cytoquel, Cytoquel. But I would recommend discuss that with your naturopathic practitioner, because I can't actually give medical advice on this call, but that could be a possibility. Okay, I've got another question here from a Heather Bird, probably for you, Samantha. Do you have suggestions for those of us with caudate atrophy who have difficulty moving on, for example, from love relationships?
Okay, so I would, so when we sort of talked about the caudate, it was kind of that kind of being stuck on difficult thoughts, or kind of that perseveration in cognition, so kind of being stuck in a thought process. So I would work on using one of the audio tracks that we're going to provide is the movie screen, which is letting yourself start to become aware of thoughts without needing to act or respond to them. So seeing thoughts as they're coming and going in your mind, but not having to follow them or react to them. When you're talking about kind of being stuck in past relationships, I'm guessing that there's probably a whole lot of behaviours that you're doing that are also kind of keeping you tied to that person. So one of the things that I would do if I was working with you is get you to look at what behaviours you're doing that keep you linked into that unhealthy relationship, whether they're texting, visiting that person, or whether they're talking about that person with friends, and get you to start looking at noticing when you want to do that and disengaging from that reaction. My suggestion would be, if this is a really unhealthy relationship for you, that you do see a counsellor to help you with that, because it can be really tricky helping to untangle from one of those relationships.
Okay, great. Also, we've got a comment here around magnesium and zinc being really important, and that's from Janelle Richmond. And I would definitely agree with that comment that and a lot of people have a disorder which is called pyrrole disorder, and it's not so well known in the medical world. But particularly if you find you're having a lot of problems recovering from an episode of anxiety, and you're just feeling a lot of anxiety out of proportion to what's actually happening in your life, then there is a condition called pyrrole disorder or pyroluria, which is worth getting tested for. And the main treatment for that is zinc and vitamin B6. And magnesium is also very important. And really, for anyone with anxiety, magnesium can be quite helpful for just calming down the nervous system. Let me see what else we've got here. Maybe lucky last. Let me just have a look here. So Marie LeBlanc has asked, how can we go back into environments and begin eating new foods we could not go into before or eat before without discrimination from others? And how can we handle the comments where people ask? So does that question make sense to you, Sam, or does it need more clarification?
I'm not quite sure about whether that's a medical question or whether it's an anxiety question.
Okay, let me read it again. So how can we go back into environments and begin eating new foods we could not go into before, eat before, without discrimination for others? So I presume what is being discussed here is during the recovery process, for instance, you all of a sudden may want to test whether you can eat certain foods that previously you were intolerant to, and maybe even try going into buildings that previously you weren't able to. And perhaps this person's talking about getting reactions from others around that, maybe not sure who, maybe partner or other people around them who understand this illness and are perhaps like, no, you should never do that. You can get some people who are a little bit fanatical, and maybe that's what this person is experiencing reactions from. Does that make sense to you? And would you be in a place to make some comments around that, you think so?
Sure. Yeah, so I can just talk a little bit on that and then maybe you can add if there's something that you think
Mhm.
medically would be helpful. So what I would suggest is if you are going to start experimenting, that you get really skilled in mindful awareness before you go, so that when you are experiencing a new environment or eating a new food, you can start to really mindfully notice, what is the reaction like in my body? What is happening when I eat this new food? Or what am I noticing when I leave that situation of that place? And I would just try one thing at a time and just really start to be mindful of, being curious about your reaction to those things. If you are going with, somebody that you worry about their judgments, I would really talk to them about what your value is in going to this place or trying this new food. So it might sound something like, it's really important for me to start regaining my life back or to be able to go to this place because it's meaningful to me in this way. And what I need from you is, to support me and, be there for me and let me try this without judgment or criticism. So I would try and set it up with that person before I went. And then if, you do have a situation where they still comment or their anxiety is showing up, being able to talk to them about that, what it's like for me when you get really anxious about, me trying this out is it actually kind of feels like it's um, undermining my confidence. And what I need from you is to just let me try this and experience it. So I think it's coming back again to communication, but really setting up with them, why is it important for you to try these new foods? Why is it important for you to get back out in these situations? And my sense would be it's probably linked to wanting to regain, your sense of, your life and your vitality.
Yeah, I think that's a great answer, Samantha. And I don't really have a lot to add to that, um, other than I think one needs to become a really good observer. And one of the difficulties with mold is that the signs are very subtle. And so perhaps, in your case, you've got some people who are concerned that, for instance, you might go into a building and you may not notice the symptoms. And I think that is a valid concern. But I think if you become really aware of even subtle symptoms, so one thing that's really important is that you make sure you've got clear nasal passages, uh, and and really hone your sense of smell. So if you don't have clear nasal passages, I recommend, as a mold sufferer, that you talk to your practitioner about that, because I believe that's one of the keys in being able to become aware of moldy buildings, is just having a good sense of smell. And yeah, it's just a matter of having that ability to tune into the subtle signs. So, for instance, you have gone to a building and then you notice that your ability to think has gone off, or there's a bit of brain fog, or your fatigue has gone a little bit worse. Well, then yes, they're more positive signs. One of my patients just today actually talked about perhaps purchasing the visual contrast test handheld kit, so that she could actually test before she went into a building, whether whether her visual contrast test would actually start failing after going into that building. So that's another kind of a tool that you could look at, or, in terms of just being able to work out whether buildings are affecting you. So, and I think the last one was just a very short one, which is around, well, there's one or two short ones that we can maybe just quickly knock off before we close off for the day. Does VIP supplementation restore normal size in the brain structures mentioned in the discussion? The simple answer is yes, it does, in around 80%. So in Dr. Schumacher's presentation from the Irvine conference, he showed that around about 80%, especially people that are on it for 6 months or more on the high dose, have reversal, and that even includes hypothalamus and amygdala and so on. But for some reason, there are some patients that seem to be a bit more resistant to that. Okay, and I think the last question was from a Jan French. How can you tell when your blood sugar has dropped, and what are the symptoms of low blood sugar? Okay, so for me, I can tell you that the symptom that, for instance, I notice are just a sense of energy dropping away, a sense that my thoughts are not as clear, and a sense that there's almost like a stress response coming up in my body, like all of a sudden I'm starting to feel really stressed and agitated. They're some of the main symptoms that I notice, but it is a little bit individual. Some people will notice that they get really hungry. Some people will notice that they get sweaty and clammy and those sorts of symptoms. So it is a little bit individual, but there's some of the things you might care to look for. Alrighty, so I think at this point I'd like to call a close to this webinar. I want to say a big thanks to Samantha for the things that she shared, and I really believe that people will have got a lot out of today. So thank you, Samantha, for joining us on this call, and also I'd like to mention that Samantha is available for Skype consults and face-to-face consults in Noosa on the Sunshine Coast. So wishing everyone a really great Thanksgiving if you're in the US, and a great rest of the day if you're in Australia. Thank you everyone for joining us, and there will be a recording available for a couple of days, and for those who join the course, that's something that's going to be available for 6 months. So thanks again everyone for joining us, and we'll talk to you again soon. Bye for now.